Assalamualaikum warahmatullahi wabarakatuh. My name is Hana Yumna. Today I will be presenting about my paper presentation about student and health workers' knowledge on COVID-19 virus transmission through mass nasal swab. A case study for Muhammadiyah Yogyakarta University medical student and health workers. And next, we will move on table contents. On the table of content contains introduction, literature review, research method, result, and discussion, and last but not least, conclusion. Okay, now we will move on discussion introduction. Wearing mask has now become a very mandatory thing in all our activities. Although previously we have also used masks in daily activities, but now we must use them outside the house every day. In daily activities such as during meals or other things, of course, we have to take off the mask. And this is quite difficult because we have also removed and wear the mask rapidly. And however, now there have been many media plays to store masks, which is a mask strap. The use of strap masks has become normality among the public, and with the cute or elegant design, various variation of strap masks with attractive color have been success in attracting children, teenagers, and also young adults. And it is undeniable strap masks that can be used by both men and women have now become mandatory accessories in carrying out in daily activities. Furthermore, the fact that masks are attached to the strap, usually removed during meals and left hanging on the chest, and that makes mask stick to clothes will cross-contaminate. On the other hand, droplets left on the mask when the user talk, coach, or sneeze can spread and be inhaled by other people who are also taking off the mask. And we know there are still many people who wear mask strap or even sell them. And it is a fact that people still don't know or don't care about the dangers they have to face because they only follow trends. And also, I think if the trend of wearing masks continue in the future, it is feared that the use of masks will not affect to preventing the transmission of coronavirus. COVID-19 transmission is very easy and very fast, so we should be careful and continue to comply with health protocols. Previously, there was no research on the spread of COVID-19 virus through mass necklace, but there have been several studies on the spread of COVID-19, but the COVID-19 virus spread through the media of mass strap has never been touched before. And now I will continue with this research paper with the research. And next, we move to research question. And the research question first, it is what is the knowledge of medical student University Muhammadiyah Yogyakarta and health workers about nasal strap mask. And the second question is, do students and health workers know how COVID-19 spread? And the next, we will move to literature review. On the literature review, we have theoretical framework. The theoretical framework have two main discussion. First, about the spread of COVID-19, and the second, how to stop COVID-19. First, we have the spread of COVID-19. COVID-19 has become a worldwide concern because of its rapid spread and many deaths. Airborne transmission is contributing to the COVID-19 outbreak. According to WHO, in general, the transmission of COVID-19 occurs through droplet transmission can occur if a person in relatively short distance. And next, how to stop COVID-19. All people are able to avoid the transmission of COVID-19. According to Kemenkes RI, we can prevent the transmission of COVID-19. One of which is by wearing a mask when outside. And of course, the use of mask today cannot be spread from our daily life. With this phenomenon, various accessories have emerged to make it easier for us to store masks and carry masks when outside. One of them is the mask knuckle strap. The mask knuckle strap works so that the mask do not fall when we remove the mask. Next is empirical review. The empirical review, in here I have two different definition from first from WHO 2020 about the COVID-19 can be transmitted through objects that are contaminated with droplets from couch or sneeze of COVID-19 sufferer. Other people would touch this contaminated object and then touch their eyes, their nose, and mouth can contact the disease. And the second one from Van der Mellen from 2020 that the virus of COVID-19 and the cause COVID-19 can survive in the air for about an hour, while on the surface of object it can last for several hours. Okay, next we will move into the research method. On the research method, in here I have a quantitative research, and then the survey instrument consists of an online questionnaire and the respondent, that is 7 students and 17 health workers. And then we move into the result. Okay, first we have the main question. In this main question we have 5 questions. The first is, I know how COVID-19 spreads. That the respondent, the majority have the strongly agree they have know the COVID-19 spreads. And the second one is, I know and follow the health protocol regarding COVID-19. And also the majority answer strongly agree about they know and follow the health protocol regarding COVID-19. And the third one is, I always update about the COVID-19. In this answer, the majority answer agree about they always update about the COVID-19. And the fourth, that the question is, I know about the mask knuckles. And the majority answer about agree that they know about the mask knuckles, but they also have disagree and strongly disagree about they don't know about the mask knuckles strap. And also the 5th question, or the last one, is, I warm or about the mask strap knuckles. In this answer, or in this question, is a majority answer agree they both are worn strap knuckles mask. And this is quite interesting. They some people answer they have don't know, or they don't bought the mask strap knuckles. It is 20% and 12% of them don't warn or about the mass nickels. Okay, we move into the next question. The next question is sporting question. This one sporting question, as you can see, the first is check one. The question is if I agree or strongly agree on the top question before. Do you immediately clean the mask strap nickel after using it? And from the check one, this show the most of them, the most respondent immediately clean the nickels, mask strap nickels after doing the activity. This can be the knowledge about the spread of COVID-19 makes respondent pay more attention to cleanliness and health. You can see from the chart too that the question is, do you know about the spread of COVID-19 through the mass rope nickels? And the respondent answered that the majority they answered yes. That it can be seen that the most respondents know that the spread of COVID-19 can be through rope mass nickel, and this shows the respondents are very aware how to COVID-19 spread. And the last support question, that if you answer yes, how did you get the information? And this is quite interesting because there are many different answers, but the most majority answer is from social media. It can be seen that 30% of respondents know information about the transmission of COVID-19 from social media. And this is a proof that digital media is quite influential for respondent knowledge about the transmission of COVID-19 through the nickel rope mask. And the others know about the COVID-19 spread through mass nickel strap from news and friends, but newspaper have a zero answer from the respondent. Okay, next we have the Likert scale. On the Likert scale, on the chart 1, respondent opinion about their age. We know I have the respondent about their age is, the respondent showed their age in range 20 to 51 years old, which means that the respondent reach a differentiable and make the results more reliable. Apart from work background, the student and health workers, age variation can be increase the accuracy the result from my risk paper, that the result analysis of student and health worker knowledge on COVID-19 virus transmission through a mass nickel strap. Okay, now we move on the discussion. On the discussion, the majority of medical students and health workers have sufficient level of knowledge about the transmission of COVID-19 through virus transmission, especially through mass nickel strap. The mass strap nickel can be a droplet for COVID-19. but there are still respondents who not understand the COVID-19 transmission through mousetrap needles. And we now move into the conclusion. And the conclusion one, this study explain the knowledge of students and health workers on COVID-19 virus transmission through the mass nasal strap. And the majority of respondents understand and know how the COVID-19 transmission, the especially through mass strap needles. And this study also explain the importance of understanding the COVID-19 transmission in daily activities, so that the risk of contracting COVID-19 will be lower. Also, with the assistance of social media and other news media, it's easier to find about the COVID-19 and the other things. And based on my result on this study, the next result is expect to be able to conduct research in the various wider area, and also expected to government and health workers as the front line in dealing with the COVID-19 pandemic to educate the public and preventing the transmission of COVID-19, so that people don't just follow trends. Alright, that's my presentation, my presenting for my paper presentation today. I hope you can enjoy my presentation, and sorry if I have any some problem from my presentation. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.